The American Red Cross announced there is a severe shortage of the nation's blood supply, and part of the reason is a reduction in blood drives, of course, throughout the pandemic. Here to talk about it is Dr. Pampee Young, the Chief Medical Officer of Biomedical Services of the American Red Cross. Good morning, Dr. Young. Welcome to BNC. Thanks for getting up and starting your day with us. Good morning. This is a critical time. And so I want you to, if you can, give us some context. What are normal blood supply amounts compared to where we are right now?
Right. So O positive and O negative blood are the most common blood that's used to support, most patients. And typically we have about 4 or 5 days supply on the shelf. We have been at certain points during this crisis down to half a day supply, and often we're running at 1 to 2 day supply. So it's very severe levels, and at points we're struggling to meet the demand of patients. So we're having to tell hospitals that we can't supply all the blood that they're asking for.
Yeah, and I'm pretty sure a lot of this has to do with the pandemic, where a lot of people weren't able to give blood, obviously for obvious reasons. But it also has a huge impact on the community as a whole. But talk about how these shortages are having a major impact on people in the Black and brown communities, in particular people with sickle cell situations, because they need this blood for transfusions.
Absolutely. In fact, we have in this country about 100,000 people who suffer from sickle cell disease. And these patients receive often frequent transfusions. They, have a lot of pain crises, and a combination of the frequent transfusions and just their clinical disease, put them at risk for developing antibodies that make them, unable to receive transfusions. So we have to be very careful about the kind of blood that we provide sickle cell patients. And oftentimes that blood, if we can get that from an African American community, it's a better matched unit for sickle cell patients. And so the Red Cross is working very hard to ask all African American donors, to healthy African American donors, to come in and donate to support this community. But overall, the blood crisis itself is absolutely having an impact on all communities, including the sickle cell communities and other communities of color, due to, just inability to, stock, group O blood. You impact, in my experience, trauma, supporting trauma, you impact supporting, transplants, and not to mention all kinds of surgeries.
Yeah, and Dr. Young, while we're getting back to normal, and that's something to be celebrated, it also presents challenges, right, in your line of work, because as people slowly return to pre-pandemic routines, that can affect the blood supply. Can you talk more about that?
Absolutely. So during COVID, surgeries were postponed, and often what that meant is, patients' condition, and patients weren't very willing to come in. They were afraid of the hospital environment, and for good reason, probably. But now that we're, coming out of the pandemic, and people are needing to get these medical conditions taken care of, and also many of the postponed elective surgeries, there's hospitals trying to do catch up and catch up on those. I think that the combination of both of those factors, people with more serious illnesses and trying to catch up surgeries that have been postponed, have really increased demand. Also, as people are going out and about their business, there's increased trauma, as we're seeing a great increase in trauma. Unquestionably, the pandemic has been difficult on this country, and we're seeing more accidental deaths and more transplants, solid organ transplants like heart transplants and liver transplants and lung transplants as a result of all of that. And so what you're seeing here is, as a consequence of the pandemic, you're seeing a great increase in demand for blood for all the reasons I just mentioned. And but also, as we come out of the pandemic, people are going back to their old routines. They're seeing family, they're traveling, and so we are having fewer donors come in to donate. So we're seeing just a combination of factors that's causing the severe shortage. Fewer donors coming in, and just a tremendous increase in demand for blood.
Dr. Young, I know we're out of time, but I have to ask you about donors who have gotten the COVID-19 vaccination. If you need blood, I know you can't be picky, but there are a lot of people out there, obviously, who still don't want to have anything to do with the COVID-19 vaccination for whatever reason they have. So if you are a donor and you've had the COVID-19 vaccination, what is the process? Do you have to inform the American Red Cross that you've had it? What is the process like when it comes to that?
Yes, that's exactly right. We ask each donor whether they've received the COVID-19 vaccine and which one, and those people who have received the vaccine are able to donate. People who have not received the vaccine are, of course, also able to donate. So all healthy donors are welcome to roll up their sleeves and come on in.
All right. Well, yeah, please give blood. It is very important, very vital to us in our community, but across this nation, across the world. Dr. Pampee Young, Chief Medical Officer of Biomedical Services of the American Red Cross, we appreciate your time, and thanks for starting your day with us here this morning on BNC.